Hi and welcome to Lessons from the Grand Rounds. In this short video, we'll be discussing a clinical case and we'll be learning about the role of hepatitis B antiviral prophylaxis in hematology patients. So we have a 56-year-old male who presented with B symptoms and generalized lymphadenopathy. The largest lymph node on examination is the right inguinal lymph node, which is by 4 by 5 centimeter, and an excisional lymph node biopsy is done. The histopathology and the IHC supports a diagnosis of DLBL GC subtype. This patient is admitted with a definitive plan of RCHOP. On routine examination and the ECG echo which we do, we find out that the patient has antibodies against the hepatitis B core antigen, which is anti-HBC, is positive for this patient. So now at this stage, while we are going to commence the chemoimmunotherapy the next day, so we have few questions regarding the patient. So the first thing is, should we give hepatitis B antiviral prophylaxis to this patient in the form of entecavir or tenofovir? The second question is, when do we start it? The third question is, what should be the duration of the antiviral prophylaxis? And the fourth question is, which hematology patients in such scenarios where we have anti-HB core antibody positive should receive antiviral prophylaxis? So the answer for the first question is that yes, we should give these patients, especially this patient, antiviral prophylaxis because he is going to receive rituximab or any other B cell depleting agent which will predispose this patient for hepatitis B reactivation. The second question is, the second answer is that we should commence the antiviral prophylaxis before the start of chemoimmunotherapy. And the answer of the third question is that the antiviral prophylaxis or entecavir should be continued at least 12 months after completion of the chemoimmunotherapy or rituximab or B cell depleting therapy or post in such scenarios. And the answer for the fourth question is that when we have anti-HBC core antibodies positive, we need to give hepatitis B prophylaxis in patients who receive rituximab or B cell depleting agents. The patients who are going to undergo an hematopoietic stem cell transplant. In the third scenario, patients who are going to undergo CAR T cell therapy, they need to have prophylaxis for hepatitis B. And the fourth indication is patients who are on highly immunosuppressive agents, um, either long term of steroids. In these four scenarios, we need to give patients entecavir or tenofovir as a part of hepatitis B antiviral prophylaxis in hematology patients. Thank you.